Okay. So each slide will give you 4 to 5 points, sometimes 7 points also. Almost 82 slides, and you count 450 points around, plus 50 MCQs around. So this is official. Unofficial I will tell some other points. So 4 hours time, 500 points. This is called real revision. Okay, if you read these all 500 points with little understanding, sufficient. I'll start with first one. See, different kind of microscopes and resolution powers are there. Okay, what is this microscope? No, this is dark background. This is called dark field microscope. This is called dark field microscope. This microscope is dark field microscope. Resolution power 0.2 micrometer. Resolution power is 0.2 micrometer. Next is, you see this microscope, it's a virus and 3D scanning electron microscope. Scanning electron microscope. What is the resolution power of scanning electron microscope? Nanometer. Nanometer, 20 nanometer. Very good. 20 nanometer. And coming this side, this is also virus, but you are seeing internal structure. So this is what microscope? Transmission electron microscope. Transmission electron microscope. Resolution power is 0.2 nanometer. Very good. Nanometer. Excellent. And this is what microscope? Dark background, organism is glowing. Very good. Fluorescent. Excellent. Fluorescent microscope. Fluorescent microscope. Resolution power 0.2 micrometer. Except electron microscope, all other people resolution power is micrometers, 0.2 micrometer. Transmission electron microscope 0.2 nanometer. Scanning electron microscope 20 nanometer. That's all. Next is basic. You should know the bacterial structure and the function. What is the first structure? We call it as flagella. The first structure is flagella. What is the function? Motility. Very good. Organ of locomotion. What is the second one? Outer cover. Outer cover. Glycocalyx. Capsule. Glycocalyx, capsule. What is the main function of capsule? Antiphagocytic. Excellent. Antiphagocytic. Each will take 1 minute. And what is the most thick part? Thick part is cell wall. Bacterial cell wall. What is the function of cell wall? It gives shape and support. And what is this? A invagination into the membrane. Mesosome. We call it as mesosome. What is the function of mesosome? Excellent. Respiration. Main function respiration and also cell wall, cell septum formation. Next is, what is it? Protein synthesis. Ribosome. Ribosome, protein synthesis. So you should know about all bacterial structure and their functions. Bacterial structure and their functions. Next is flagella. What are the different flagellar arrangements and this thing? What is the different flagellar arrangement and this thing? Okay. Yeah. See carefully. This is called what trichus? Monotrichus. Example. Vibrio. Campylobacter. Many are there. Vibrio, Campylobacter. Many are there. Okay. Next is, what is it? tough flagella at one end. It is called lophotrichus. It is called lophotrichus. Example, Helicobacter pylori. Excellent. Next is, what is it? Both side. Amphitrichus. Just recollect. Spirillum. Excellent. Spirilla. And all over the body. Peritrichus. Many people. E. coli. Very good. That's all. That only we need, my dears. E. coli. Okay. E. coli. Next is, see, different culture methods. Different culture methods. What is this method called? We are puncture. What is it called? Stab culture. We call this as stab culture. What is the use of stab culture? Oxygen requirement, motility. Oxygen requirement as well as motility. It's a total revision. What is this method? Streak culture. Excellent. We call them as streak culture. What is the advantage of streak culture? Isolation from mixed population. Mixed population. Isolation from mixed population. And what is it? This box with a pouch. We call it as gas pack system. For cultivation of anaerobes. Very good. Cultivation of anaerobe. Gas pack system, cultivation of anaerobe. And what is it? Lawn culture. Excellent. This is called lawn culture. What is the advantage of lawn culture? Yes, already there. Antibiogram, antibiotic sensitivity testing, Forge typing. Antibiogram as well as Forge typing. Next is bacterial growth phases. Yeah, there are 4 phases. You should know 1 or 2 points. A stands for lag. In this phase, it prepare for size will increase, prepare for multiplication. Very good. Increase in size and prepare for multiplication. What is the B phase? It's called logarithmic phase. Exponential phase, increase in number. Very good. And you can demonstrate any original characters. What is phase 3? Stationary. Very good. In this phase only you can get sporulation, storage granules, everything. Very good. Sporulation, storage granules, everything you can get in the stationary phase. Next is phase D, decline. In the decline phase, involutional forms. Excellent. In the decline phase, you are getting involutional forms. This is about bacterial growth phases. Bacterial growth phases. Lag, log, stationary and decline phase. Each phase you should know what happens, at least 1 or 2 points. Just you can revise. Okay, right. Bacterial oxygen requirement. Based on the oxygen requirement, what is it? It grows on the top. Where there is presence of oxygen, it will grow. What is it called? Obligate aerobe. Excellent. We call it as obligate aerobe. We called it as obligate aerobe. Second one, where there is no oxygen, it will grow. Obligate anaerobe. Excellent. Obligate anaerobe. They will grow all places, both facultative aerobe or anaerobe. Facultative aerobe or anaerobe. Facultative aerobe or anaerobe. Next is, they will grow in the absence of oxygen. They will survive in the presence of oxygen. We call it as aerotolerant anaerobe. We call it as aerotolerant. Example, Clostridium perfringens. They will grow subsurface, low oxygen concentration. Bacteria which grows low oxygen concentration, what is it called? Only one is pending. Microaerophilic. 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 Obligate aerobe, obligate anaerobe, facultative aerobe or anaerobe, aerotolerant anaerobes, microaerophilic. Got it? This is based on the oxygen requirement. Each slide will cover one topic. One is stain, one is microscope, okay, one is oxygen requirement, one is culture methods, one is growth curve. So don't worry, whole microbiology will be revised. Page by page will revise, don't worry. Okay. It's a bacterial gene transfer method. See carefully here. This is the plasmid. This is the pilus. So via the plasmid travel via pilus. What is the process called? Yes. The plasmid transfer via pilus is called, excellent, conjugation. We call this as conjugation. Example for conjugation. E. coli. E. coli is a classical example. It was first described by Liederberg. Okay. And see here, bacteria died, DNA freely available. Other bacteria take the DNA and incorporate with existing DNA. Transformation. This is called transformation. Direct uptake of naked DNA. First it was described in which bacteria? Streptococcus pneumoniae by Griffith. There was an experiment called Griffith experiment. Streptococcus pneumoniae. Streptococcus pneumoniae, Griffith experiment. Next is quality control agents of different methods in sterilization and disinfection. Okay, what is the first one? Yeah, already there. They're beautifully written here. If you are ultra smart, you can identify. This is hot air oven. What is the quality control agent? Bacillus atrophius. Excellent. Subspecies Niger. Excellent, excellent. Bacillus atrophius, subspecies Niger. Bacillus atrophius, subspecies Niger. Excellent. Come on, what is it? Little difficult. Okay, I will give the idea to you. This is a filter, air filter, HEPA filter. What is the quality control agent for all filters? Excellent. Serratia marcescens, Brevindimonas diminuta. Remember Serratia. Serratia and Brevindimonas. Serratia and Brevindimonas. These are all the quality control agent for filters. What is it? Autoclave. Excellent. That's all. If you identify the equipment, 50% job over. Autoclave. What is the quality control agent for autoclave? Geobacillus Styrothermophilus. Should not forget, my dears. Geobacillus Styrothermophilus. Geobacillus Styrothermophilus. Geobacillus Styrothermophilus. That is the quality control agent. This is gamma rays. This gamma rays. What is the quality control agent for gamma rays? Bacillus pumilus. Bacillus pumilus is the quality control agent for this one. So see here, all important. If you want, I can add more also, but this is sufficient. Ethylene oxide, quality control agent is Bacillus atrophius subspecies globigi. Okay, for ethylene oxide, you can add. Yes, very interesting. You need to apply Spalding classification. Start with this equipment. What is it? Endotracheal tube, anesthetic equipment, comes under semi-critical. Excellent. It comes under semi-critical. Okay. Next is, what is it? ECG leads comes under non-critical because we are on the intact skin. Very good. Non-critical. Non-critical. What is it? Flexible endoscope comes under semi-critical. Bedpan, reusable bedpan comes under semi-critical. Disposable bedpan comes under non-critical. It is the reusable. See, it's ever silver. It's made up of silver. Okay, reusable comes under semi-critical. Semi-critical. Foley's catheter. Any urinary catheter and cardiac catheter comes under critical. Very good. Critical. Any urinary catheter or cardiac catheter comes under this one. Next is cutting endoscope, rigid endoscope, critical. Flexible endoscope, semi-critical. Rigid endoscope, critical. See carefully here. That's all. So you should know about Spalding classification, all in one. So once you understand what is Spalding classification, then only you can answer this question. Indirectly, it reflects your level of understanding in Spalding classification. Okay, right. Yeah. One equipment. What is the name of the equipment? Don't worry. Door is opened. Previously the door was closed. You identified. Hot air oven. What is the type of heat we are using? Dry heat. Excellent. We are using dry heat for this one. What is the application of this? No applications. Okay, what is the mechanism of action? You told mechanism of action. Protein denaturation. Protein denaturation. Okay, what is the procedure? 170 degree for 1 hour or 160 for 2 hours. Remember, 170 degree for 1 hour. That's a common. Suppose if the option is not there, think of 160 degree for 2 hours. Okay. Next is, what is the application of hot air oven? Yes, glasswares, wax, powder, all those things which is spoiled by moisture. You can go for glasswares, powders, wax, metals, all. Wax, metals, glasswares, powders, these are all application of. So only one equipment. How many questions we are asking? We can ask many questions. This give a clue to you. This give a clue to you. Okay, right. Next is, we started the class exactly at 10 o'clock. 12 o'clock is the break. 15 minutes break. Then 12:15 we'll start. Then 2 o'clock will be over. Maybe 5 minutes, 10 minutes extra I may take, but 99% that will not happen. Don't worry. You know about my timing. Okay. Yes. Yes. So we completed 10. Yes. See carefully here. This is important. Some bacteria or bacterial products mimic like our own tissues. So antibody produced against that bacteria attack our own cells. Okay, that's called autoimmunity. Some autoimmunity associated with some microbes. Rheumatic fever associated with which bacteria? Streptococcus. Acute rheumatic fever, it is with gas. What is gas? Group A beta hemolytic streptococcus, or common name Streptococcus pyogenes. So the antibody produced against M protein attack our myocardium. Guillain-Barré syndrome, GBS. It's a type of ascending paralysis. All in my notes. If you read the notes, it will be there. It associated with, it's a complication of one disease. Campylobacter jejuni. Ascending paralysis. Botulism, descending paralysis. Campylobacter jejuni. Campylobacter jejuni. Reiter's syndrome. Reiter's disease. The famous mnemonic is there. Can't see, can't pee, can't climb the tree. It causes conjunctivitis, urethritis, arthritis. Many people, Shigella, chlamydia, Campylobacter, many things. HLA-B27, Shigella, Campylobacter jejuni, chlamydia, many are there. Yersinia, even E. coli, Salmonella, many are there. You remember as much as possible. Multiple sclerosis associated with which organism? Two people. One is chlamydia, another one is Epstein-Barr virus, EBV. Epstein-Barr virus or chlamydia. Chlamydia or Epstein-Barr virus. Viral myocarditis. Which organism commonly associated with viral myocarditis? Most common cause of viral myocarditis. Coxsackie B virus. Coxsackie B virus. Coxsackie B virus. Coxsackie B virus. Microbes associated with autoimmunity. This is important. You may get a question. Next is hypersensitivity. 100% we may get a question on examples of hypersensitivity. Okay, allergic rhinitis, allergy. 1. Everybody happily answering, huh? Yes, I pray this question should come. Okay, right. Contact dermatitis. 4. If you already studied, it come like revise. Type 4. Serum sickness. 3. Orthus reaction, serum sickness type 3. Graves disease. 2. So you should know examples for all. PK reaction type 1. Prausnis-Kushner reaction type 1. Lepra reaction type 3. Lepra reaction type 1 comes under 4. Type 2 and 3 comes under 3. We call it as Lucio phenomenon. It comes under both category. Rheumatoid arthritis, if it is cell mediated mechanism, comes under 4. If it is antibody immune complex mediated, comes under 3. Okay, but majority contribution from type 4. Okay, so this slide will give an idea to approach examples of hypersensitivity reactions. Okay, next is, hey, don't worry. This is a video based question. I cannot show the video in the book. I gave another picture. You can see the video and answer. Okay. Yeah. Now you see this antigen go and attach directly to the T cell receptor. This antigen directly attached to the T cell receptor. It bypasses antigen processing, antigen presentation. Okay, what is the name of the antigen? That is the question. What is the name of the antigen? Antigen which bypasses antigen processing presentation directly attached to the T cell receptor. It is called super antigen. We call it as super antigen. What is the binding site? If you see your textbook, you can say it's already there in the textbook. Variable beta side chain of the T cell receptor. Variable beta side chain of the T cell receptor. Variable beta side chain of the T cell receptor. See, the red color is the antigen, super antigen. See carefully here. See carefully here. In your textbook, there is a picture red color. That red color is called what? Super antigen. This is super antigen. Where it attaches? Variable beta side chain of the T cell receptor. Antigen name super antigen. Example. All staphylococcal toxins are super antigen. So toxic shock syndrome toxin, enterotoxin, exfoliative toxin. Exfoliative toxin. Apart from that, streptococcal pyrogenic exotoxin, SPE. You have mycoplasma toxin, mycoplasma, Yersinia, Clostridium perfringens, all produces super antigen. Even rabies, HIV, influenza, all people produce a super antigen. They just bypass antigen processing presentation, directly attached to where the, what is the site? Variable beta side chain. Variable beta side chain of the T cell receptor. Okay, right. One more, also video based question. See the video and answer. See the video and answer. See carefully. Antibody. We are coating antibody on the well. After that, we are adding patient serum which contains the antigen. It comes and binds. After that, we are going to add enzyme linked antibody. Okay. After that, we are adding substrate. It produces color. After adding substrate, it produces color. So now, what is the name of the test? ELISA. The name of the test is ELISA. What is the type? It is direct or indirect? Direct ELISA. Detection of antigen, because you are quoting antibody. Direct ELISA, detection of antigen. Detection of antigen, you are quoting antibody. Okay. What is the name of the enzyme you are using? Horse radish peroxidase. The name of the enzyme is called HRP. Horse radish peroxidase, we call it as HRP. This is the enzyme we are using. ELISA test. Hope you understand, huh? Yes. Next is listen to me carefully. Immunodiffusion tests, one by one, don't worry, because certain animations we cannot make it in your book, but your book contains all the contents, don't worry. See carefully here. Antigen antibody. Now the antigen diffuses into the antibody, it forms the line of precipitation. Can you describe what dimension of diffusion? 2-dimension single diffusion. What is the name of the test? We call it as Mancini test. Mancini test. See carefully here. I am keeping antigen and antibody. Antigen moves into antibody, antibody moves into antigen. Where they meet optimum concentration, they form line of precipitation. Can you describe what dimension or diffusion? 2-dimension double diffusion. Excellent. 2-dimension double diffusion. What is it? Acharloni test. Acharloni test. Next is antigen diffuses into the antibody. Where they meet optimum concentration, they form line of precipitation. Yeah. 1-dimension single diffusion. What is it called? Excellent. This is called Odin. Automatically one is missing. 1-dimension double diffusion. Okay. Where they meet optimum concentration, it forms the line of precipitation. Then what is it called? Oakley-Fullthorpe. You should remember all the names. Oakley-Fullthorpe. Oakley-Fullthorpe. Mancini, Odin, Aucherlony, Oakley-Fulthorpe. We used to say odd in Oakley-Fulthorpe, Mancini, Aucherlony test. Mancini, Aucherlony test. This is important. You may get a question. If you are answering this question correctly, this will differentiate you from other people, because many people do mistake here. You should be alert. Okay. Got it? Right. Yeah. Next is, what is the diagnosis? Yeah, the child is having cleft palate, and see the eyes, see the facial, abnormal faces, the distance will be high, okay, and cleft palate. What is the name of the disease? Syndrome. DiGeorge syndrome. We call it as DiGeorge syndrome. Which cell defect? DiGeorge syndrome. DiGeorge syndrome is T cell defect. Excellent. What are the features of DiGeorge syndrome? There's a famous mnemonic. Catch 22. Okay. Cleft palate. Abnormal faces. Thymic hypoplasia or thymic aplasia. Cardiac defect like tetralogy of Fallot, and hypoparathyroidism or hypocalcemia. Hypoparathyroidism or hypocalcemia. Hypoparathyroidism, hypocalcemia. We call it what is the mnemonic? It's called Catch 22. What is the 22 stands for? Excellent. Chromosome deletion is 22q11. So, if the child is not having T cell, what immunity got affected? Cell mediated. So, what pathogens may affect? All kind of intracellular pathogens, especially viruses, fungus, those kind of intracellular pathogens. Intracellular pathogens, which includes viruses, protozoa, mainly fungus, those kind of people. That's all. Okay, next is bacteria isolated from osteomyelitis pus. Which is the most common cause of osteomyelitis? If you know this, Staph aureus, you keep it in your mind. So, most common cause of osteomyelitis overall, Staph aureus. So, the bacteria isolated. What is the name of the test? Here, something solid formation, here it is not there. This test is a very famous test which differentiates Staphylococcus aureus from other people, is coagulase test. The name of the test is coagulase test. Yes, Kamal Kaushik. Agent Staphylococcus aureus. It is gram positive cocci in clusters. Very good. It's a gram positive cocci. What is the arrangement? Clusters. What is the selective medium for Staphylococcus? If you know these 5 points, all key points about Staphylococcus over. There is a medium called Ludlam medium, mannitol salt agar. Ludlam medium or mannitol salt agar. Very good. and it has a virulent factor called protein A. What is the function of protein A? It attached to the Fc portion of immunoglobulin. It attached to the Fc portion of immunoglobulin. This is about Staphylococcus. When you know it is osteomyelitis pus, that time itself you need to identify this Staphylococcus and points related to Staphylococcus. Next is bacteria. Sorry, this is not correct thing. Okay, question is wrong. Okay, I'm sorry. This actually what? Yeah, just you see the image. What tongue? Excellent, strawberry tongue. Strawberry tongue. The copy paste error happened. Remove that question, don't worry. Strawberry tongue. Which agent causes strawberry tongue? Streptococcus pyogenes, otherwise called gas. Group A beta hemolytic streptococcus or Streptococcus pyogenes. Yes, perfect, Kaushik. What is the gram strain of Streptococcus? Gram positive cocci in chains. Arranged in chains. Always you should remember the selective medium, mandatory. What is the medium for Streptococcus? PNF medium. PNF. Polymyxin, neomycin, fusidic acid medium. PNF medium. Disease, strawberry tongue, caused by which fever? Scarlet fever. It causes scarlet fever. Apart from that, it causes many things. Sore throat. Okay, Kawasaki disease also another cause of strawberry tongue. But this disease, group A beta hemolytic streptococcus, causes scarlet fever, sore throat, impetigo, erysipelas, many things, necrotizing fasciitis, many things. Okay. Right. Next is meningitis in a splenectomy patient. Any splenectomy patient undergo, yeah, they may get infection from capsulated pathogens. What are the capsulated pathogens? NHS organism. Okay, see carefully here. Here, before adding antiserum, after adding antiserum, there is swelling of capsule. Swelling of capsule. Okay, swelling of capsule. What is the name of the test? That's all, Kollang reaction. Kollang reaction. What is the agent? Pneumonia, because it is diplococci. See, diplococci, flame shaped diplococci. So it is Streptococcus pneumoniae. Streptococcus pneumoniae. Gram stain, yeah, gram positive, diplococci, flame shape or lanceolate shaped diplococci. Shape diplococci. Pairs. What colony morphology? Draughtsman colonies. Yeah. Draughtsman colonies. Important virulent factor? Yeah, already there. What is it? The important virulent factor is polysaccharide capsule. Polysaccharide capsule, pneumolysine. The whole bacteria, if we know this 5 to 6 point, that's the revision. Polysaccharide capsule, pneumolysine. Polysaccharide capsule and pneumolysine is the virulent factor, is the virulent factors. Okay, next is child with bull neck. That's all. So if you are good in theory, after reading the first line itself, you say it is diphtheria. People happily, my kids are saying, sir, that is diphtheria, sir. Yes. First differential diagnosis, diphtheria, acceptable. After seeing the oral cavity, what you are finding? Pseudomembranous tonsillitis. Pseudomembranous tonsillitis. So your diagnosis is perfect. Okay. So what is the lesion? Pseudomembranous tonsillitis. What is the agent causing? Corynebacterium diphtheriae. Don't worry. Corynebacterium diphtheriae. It possesses a typical granule. What is the name of the granule? That is a peculiar feature. The peculiar feature for diphtheria, two things. One thing, Chinese letter pattern arrangement. Second thing, granule. That is called volutin granule or metachromatic granule. It possesses metachromatic granule. Yeah. The staining technique is called PAN. Ponder Albert Neisser stain. Metachromatic granule, otherwise called, what is the name of the granule? Volutin granule or Babes Ernst granule. These are all the other names. Babes Ernst granules. What is the selective medium for diphtheria? You should know all selective medium ideas. No mercy, no relaxation, no compromise. You must know all selective medium. One question is with you. One or two questions are with you. Happily you can attend. Come on, what is the medium? Yeah, that's called McLeod medium, Tinsdale medium. It produces black colonies. McLeod agar or Tinsdale agar. Tinsdale agar. Just a minute. Okay. Toxin. Okay. Toxin mechanism of action is, what is the mechanism of action of the toxin? Acting on elongation factor 2 to inhibit protein synthesis. Acting on elongation factor 2 inhibit protein synthesis. Inhibit protein synthesis. Acting on elongation factor 2 inhibit protein synthesis. Got it? Next is see carefully here. Yeah. Very interesting. Skin lesion of an aborteur. Where there is aborteur, you should think of anthrax because it causes Hyde-Porter disease. What is the name of the lesion? Black necrosis in the center, peripheral inflammation. This is called very good. People rightly mentioned Eschar or Eschar. Eschar or Eschar. Okay. What agent? Yes, Bacillus anthracis. Very good, my dears. Bacillus anthracis is the agent. Okay. What is the gram smear? Gram positive bacilli. What is the arrangement? Bamboo stick, you get it from the culture. This is from specimen. So gram positive bacilli, boxcar appearance. Like this. In the specimen, you get boxcar. In the culture, you can get bamboo stick. Culture, bamboo stick with spores. Bamboo stick with spores. Here no spore. Boxcar appearance. Medium. What I already told. Every bacteria you must know the selective medium. Plet medium. PLET medium. Polymyxin. Lysozyme. EDTA. Thallus acetate. Polymyxin, lysozyme, EDTA, thallus acetate medium. What colony? Hair full of snakes. Medusa head colonies or frosted glass colonies. If you see like this, frosted glass or Medusa head, seen under microscope, Medusa head colonies. What is the capsule made up of? Very good. Polypeptide capsule. Okay. Polypeptide capsule. Capsule is made up of polypeptide. Polypeptide capsule. Okay. Polypeptide capsule. Next is soldier with gunshot injury, deep-seated injury. What is the name of the test? This is called opalescent colonies. Where there is antitoxin, normal. Where there is no antitoxin, it produces opalescent colonies. What is the name of the test? It is called Naegele's reaction. Agent? Clostridium perfringens. Clostridium perfringens. What is the virulent factor for Clostridium perfringens? Main virulent factor. It possesses alpha toxin, lecithinase activity. That only we are demonstrating in the. This is due to lecithinase. Okay. This is alpha toxin. Virulent factor is alpha toxin. Lecithinase activity. Lecithinase activity. Disease. What is the disease causes? Clostridium perfringens. Gas gangrene. Necrotizing enterocolitis, NEC. Pig bell. What about the oxygen requirement of this bacteria? Its Clostridium comes under anaerobe, but they can tolerate oxygen. Aerotolerant anaerobe. It comes under aerotolerant. Aerotolerant anaerobe. Aerotolerant anaerobe. Next is patient with UTI, urinary tract infection. What is the appearance called? Swarming. The colony is called swarming. This colony we call it as swarming. What is the agent causing swarming? Many people cause, but UTI, Proteus. Because of UTI we say Proteus. Otherwise swarming caused by many people. Swarming caused by Burkholderia pseudomallei, swarming caused by Vibrio parahemolyticus, Clostridium tetani, Campylobacter. Many people cause swarming, but UTI. Okay. What is the smell of the Proteus? Fishy smell. It possesses one specific enzyme. My notes. If you demonstrate the enzyme, you can identify Proteus. Phenylalanine deaminase. Name of the test, phenylpyruvic acid test, PPA test. Name of the enzyme, phenylalanine deaminase. Phenylalanine deaminase. Name of the enzyme, phenylalanine deaminase. Name of the test, PPA test. Phenylpyruvic acid test. Phenylpyruvic acid test. Next is renal stone. Very good. Staghorn stone or Sturvite stone. Fantastic. Staghorn stone. Sturvite stone. Sturvite stone. Staghorn stone or Sturvite stone. Okay. Staghorn stone or Sturvite stone. Got it? That's all. It is about Proteus. You must know points in Proteus. Proteus causes UTI with renal stone. Important enzyme, phenylalanine deaminase. Fishy smell, exhibit swarming, UTI. That's all. These 4-5 points must know in Proteus. Next is a patient with facial nerve paralysis. Okay, what is the lesion? What is the name of the rash? This rash is called annular rash or target rash. Annular or target rash caused by rash, round target rash. Classical picture, very good. Lyme disease. What is the agent? Borrelia burgdorferi. Very good. Borrelia burgdorferi. Borrelia burgdorferi. Which agent causing? What is the name of the vector? Tick is the vector. Ixoid. Tick is the vector, remember. Tick. And what is the medium? You should know. Kelly B medium. There is a medium called all selective medium, you should know. And what are the CNS manifestations? Already you are aware of that. The first line itself, what is the question? Yeah, that is the CNS manifestation. Facial nerve paralysis, otherwise called what palsy? Bell's palsy. Bell's palsy, very good. Bell's palsy, otherwise called this one, Bell's palsy. Okay, Bell's palsy. Next is swimming in a pond contaminated with rat excreta. That's all. Rat excreta, swimming pool, what disease it may be? Leptospirosis. What is the name of the stain? Silver stain, called Fontana stain. Leptospira specific stain is Fontana stain. What is the name of the agent? You know that, already all answered. Leptospira interrogans. Leptospira interrogans. What motility it exhibits? Corkscrew motility. All spirochete basic motility, corkscrew motility. I already told you, no, you must know the medium. All questions, my medium is default. All slides, medium is default. What is the medium? Famous medium, EMJH medium. Ellinghuisen, McCullough, Johnson, Harris medium, Fletcher medium, Fletcher's medium, Korthoff medium, Fletcher's medium, Korthoff medium. Gold standard test, MCQ. Serology, what is the name of the test? MAT, microscopic agglutination test. That is a gold standard test. Microscopic agglutination test. Gold standard test. Okay, gold standard test, MAT. Yes, perfect. Lashing motility, Kamal Kaushik asked one question. Lashing motility seen in Borrelia burgdorferi. Borrelia burgdorferi. Gold standard MAT. Yes, Kamal. Perfect. Next is pathogen from vertebral osteomyelitis. See carefully here. Vertebral osteomyelitis, you need to know two people. Common vertebral osteomyelitis, 3 people. Any osteomyelitis, staph. Apart from that, spine, pot spine caused by Mycobacterium tuberculosis. Another important fellow is brucellosis, vertebral osteomyelitis. What is the name of the medium? This is solid, this is liquid. It is having both phases. Biphasic medium. What is the name of the biphasic medium? Castaneda biphasic medium. Castaneda biphasic medium. Mainly used for brucellosis, brucella. If you do the gram stain, brucella gram negative Coccobacilli look like safety pin appearance. Many people safety pin. One example is brucella. And can anyone tell what is the growth factor? Little tough question, but remember erythritol. Erythritol is the growth factor. What is the disease caused by brucella? Brucellosis. What is the other name? Malta fever, undulant fever. We call it as Malta fever or undulant fever. Malta fever or undulant fever. Malta fever, undulant fever. Okay, right. Next is listen to me. Keratitis from contact lens user. That's all. Keratitis from contact lens user. Who is the most common cause? Amoebic keratitis, acanthamoeba. General keratitis, Pseudomonas. And what is the color of the colony? Green color. So agent is Pseudomonas aeruginosa. Agent is Pseudomonas aeruginosa. What is the selective medium? I already told you. Selective medium is a default. You must know all selective mediums. Okay, what is the selective medium? Very interesting medium. Cetrimide agar. Cetrimide is antiseptic. It inhibits many bacteria, not this bacteria. Cetrimide agar. Cetrimide agar. What is the smell of this bacteria? Fruity smell, sweet fruity smell or grape smell? Fruity or grape smell? Sweet, fruity or grape smell? Got it? What pigment it produces? It produces 4 types of pigment. Pyocyanin, pyorubin, red color, pyoveridin, yellow color, pyomelanin. Pyomelanin, black to brown color. Pyomelanin. What is the mechanism of action of the toxin? Yes, this toxin acts like diphtheria toxin, acting on elongation factor to inhibit protein synthesis. Inhibit protein synthesis. Inhibit protein synthesis. It acting on elongation factor to inhibit protein synthesis. Keratitis from contact lenses. Yes, it possesses exotoxin A. Exotoxin A. Okay, exotoxin A. Next is young man admitted with meningitis. Adult meningitis, think of 2 people. One is meningococci, Neisseria meningitidis or Streptococcus pneumoniae. But what is the picture says? What is it called? Purpura or petechial hemorrhage. Purpura or petechial hemorrhage, you can go for Neisseria meningitidis or meningococci. Neisseria meningitidis or meningococci. What is the mode of transmission? Respiratory, droplet. In case of gonococci, sexual. It is droplet. Inhalation. What is the important virulent factor of this one? What is the important virulent factor? Polysaccharide capsule. Polysaccharide capsule. What is the vaccine strain? Tetravalent vaccine. We are using ACWY vaccine, both polysaccharide as well as conjugate vaccine available. Both polysaccharide as well as conjugate vaccine available. Okay, what complication we can expect? It causes adrenal hemorrhage, fulminant meningococcemia. We call it as Waterhouse-Fridtchen syndrome. Waterhouse-Fridtchen syndrome. Waterhouse-Fridtchen syndrome. Okay. Kamal Kaushik is beautifully answering. Okay. In the chat box. I'm seeing in the chat box also. Okay. Waterhouse-Fridtchen syndrome. Next is diarrhea after consumption of antibiotics. Wow, very good. What is the name of the disease? Antibiotic associated pseudomembranous enterocolitis. Enterocolitis. What is the agent? Clostridium difficile. Old name was Clostridium difficile. New name Clostridium difficile. Both are same. Don't worry. Very good. What are the drugs associated? What are the drugs causing this? Any drug can cause. Any drug, but common culprits: clindamycin, aminopenicillins, fluoroquinolones. Common drugs: clindamycin, aminopenicillins, cephalosporins, many things. What is the selective medium? I already told you, no. If you read all the slides, indirectly you read all selective mediums. The medium is called CCFA medium. What is CCFA? Cycloserine, cefoxitin, fructose agar. Fructose agar. What is the drug of choice? Yeah, vancomycin is first line, but best drug is fidaxomicin. Vancomycin, fidaxomicin. Vancomycin and fidaxomicin. Okay. Vancomycin, fidaxomicin. I'm seeing the chat box. Dr. Kamal Kaushik is beautifully answering. I'm so happy also. Good. Right. Next is patient with atypical pneumonia. Most common cause of atypical pneumonia. Atypical pneumonia caused by 3 people. Remember MLC, Mycobacterium, Mycoplasma pneumoniae, Legionella and Chlamydia pneumoniae. Most common causes Mycoplasma pneumoniae. Mycoplasma pneumoniae. What type of motility it exhibits? What type of motility it exhibits? Gliding motility. It exhibits gliding type of motility. Mycoplasma pneumoniae, gliding type of motility. Got it? What medium for Mycoplasma? This is a medium called Eaton agar or PPLO agar. Eaton agar. Eaton agar or PPLO agar. What is PPLO agar? Pleuropneumonia like organism. Don't worry, you know all mediums. Now itself you came across almost 20-25 medium. Okay, right. What colony? See how the colony look like. Fried egg colony. Fried egg colony, otherwise called bullseye colony. Bullseye colony. All drug. What is the drug of choice for all atypical pneumonia? A for A. Azithromycin is the treatment. Very good. Azithromycin is the treatment. Okay. Azithromycin. Azithromycin is the treatment. Okay. Drug of choice. That's all. This about Mycoplasma. This about Mycoplasma. Minimum per slide 5 to 6 points. Okay. That's all. Next is, we completed 30. Before tea break, we need to complete at least 45. Okay, right. Yes, infant with dry cough on expiration and a woofing sound. Yes, everybody knows. What is the agent called? Bordetella pertussis. Excellent, excellent. Bordetella pertussis. Gram appearance, thumbprint appearance. Can you name the selective medium? There are two mediums available. Bordetella pertussis, there are two mediums available. What are the two medium? No idea? Bordet Jengu medium, Regan Lowy medium. Bordet Jengu potato glycerol medium or simple Bordet Jengu medium. Another one is Regan Lowy medium. Regan Lowy medium. What is the colony morphology? See the colony, how it look like. You people can tell. Yeah, it's look like mercury drop, aluminium paint or bisected pearl appearance. All are important, my dears. There are three types, all are same. Mercury drop, bisected pearl, Another one is mercury drop, bisected pearl. What is the another one? Not string of pearl. Bisected pearl, mercury drop, aluminum paint. String of pearl seen in Bacillus anthracis in the presence of penicillin. Okay, right. Next is aluminum paint appearance. Aluminum paint appearance. What is the mechanism of action of pertussis toxin? Or sorry, toxins. It possesses 5 types of toxin. One is called pertussis toxin, filamentous heme agglutinin. You know that. Tracheal cytotoxin, adenyl cyclase toxin, dermonecrotic toxin. These are all different toxins produced by Bordetella pertussis. These are all the different toxins produced by Bordetella pertussis. Okay, different toxin produced by Bordetella pertussis. Yes. Next is fever with bubo, where there is a bubo and see the bacteria, how the bacteria look like. Typical bipolar staining, safety pin appearance. What is the agent? Safety pin appearance, bubo. No. Yersinia pestis. Yersinia pestis. Yersinia pestis. Which causes plague? Yersinia pestis. Stain. What is the name of the stain? Mason stain. It produces safety pin appearance. It produces typical safety pin appearance. What medium? Ghee broth. We are using ghee broth. In the ghee broth, it grows in the walls of the ghee broth. We call it a stalactite colony. It produces stalactite growth, stalactite colony, ghee broth. What disease it produces? Everybody knows. Pandemic, plague. Different types are there. Bubonic plague, pneumonic plague, septicemic plague. Bubonic, pneumonic and septicemic plague. Got it? Next is child with typical rash on the face. After seeing the face, what comes to your mind? Excellent. Okay, what is the description of the image? What type of rash? Slapped cheek rash. What is the name of the disease? Fifth disease, erythema infectiosum. Erythema infectiosum. Agent, parvovirus B19. Parvovirus B19 is the agent. In fetus, what is it causes? It go and destroy the RBCs, fetal eye drops, non-immune fetal eye drops. Non-immune fetal eye drops. Adult manifestation, in adults it causes polyarthritis. Adult manifestation, polyarthritis, it causes polyarthritis. Polyarthritis. There is one more slide also there, don't worry. Same thing will come one more time, don't worry. Next is bacteria under microscope. What is this description called? Okay. What is it called? This is called bamboo stick appearance. Which agent causes bamboo stick appearance? Is Bacillus anthracis. Bacillus anthracis. And what is this appearance called? There is a capsule is there, bacteria is like this. Capsule is there. Lanceolate shape or flame shape. Okay, this is lanceolate or flame shape. Lanceolate or flame shape bacteria. Okay, Streptococcus pneumoniae. Streptococcus pneumoniae, lanceolate or flame shaped bacteria. Streptococcus pneumoniae. Got it? Next is bacteria under microscope. How it look like? Comma shaped bacteria, single polar flagellum, here and there. It present here and there. This is called fish in stream appearance. Fish in stream appearance. Seen in Vibrio cholera. Fish in stream appearance seen in Vibrio cholera. See here, they are like school children. They are going one by one. School of fish appearance. School of fish arrangement. Haemophilus ducreyi. Haemophilus ducreyi. School of fish. Haemophilus ducreyi. Fish in stream, Vibrio cholera. No confusion. Fish in stream, school of fish. It's otherwise called tram track arrangement. Tram track arrangement. Fish in stream, tram track arrangement. Okay, fish in stream, tram track arrangement. Next is pneumonia in post-renal transplant recipients. Yes, what the image says. Yes, after that you remember CMV. CMV, image owl-eye appearance. Agent cytomegalovirus. What is the name of the antigen assay for CMV? There is an antigen assay called PP65 antigen assay. PP65 antigen assay. What is the drug of choice? Ganciclovir, valganciclovir, Apart from that, you have phoscarnet. Ganciclovir, valganciclovir, phoscarnet. Phoscarnet. Ganciclovir, valganciclovir, phoscarnet. Cytomegalovirus. Post-renal transplant recipients. Common cause cytomegalovirus. Okay, if it is more than 6 months, BK virus. Less than 6 months, cytomegalovirus. If it is more than 6 months, think of BK virus. Think of what virus? BK virus. Okay, think of BK virus. Next is child with rash. Child with rash, you are able to see something what is called white lesion in the oral cavity. Very good. This is called what spot? Koplik spot. Excellent. Koplik spot. Agent measles virus. What is the new case definition? Old case definition was cough, coryza, conjunctivitis. Cough, coryza, conjunctivitis. CCC. Cough, coryza, conjunctivitis. This was old. What is the new one? Very simple. Fever with rash. The new case definition is fever and just rash. Fever and rash. Old one CCC. New one fever rash. Now you tell, what is the complication? Excellent. SSPE, subacute sclerosing panencephalitis. SSPE is the well-known rare but fatal complication. It's a rare but fatal complication. Rare but fatal complication. Okay. Next is feeling well. No, my concentration on this. So I don't know what happening here. Okay. And you people coming from the area which is so cold, no? Yeah, many people stayed in minus temperatures. Okay. Okay, no problem. Child with fever and rash. Child with fever and rash. Okay. Fever with rash. What about the rash? What about the lesion? Slap cheek. Again it's coming. Slap cheek rash. Disease? Yeah, fifth disease. Otherwise called erythema infectiosum. Erythema infectiosum, fifth disease. What is the agent? Parvovirus. What is the serotype? B19. Simple. Repeat. Genome. What is the genome of the virus? Is it DNA virus or RNA virus? It's a DNA virus. Single strand, double strand? Yeah, it is the single stranded DNA virus. one and only medically important single stranded DNA virus is parvovirus. Parvovirus. Okay. In case of sickle cell disease, what it causes? Pure red cell aplasia. Pure red cell aplasia. Pure red cell aplasia. It causes pure red cell aplasia. Single stranded DNA virus. 5-10 minutes will finish it off. Break will come. Just a minute. Just a minute. Just a minute. Yeah, I am calling the people. Okay. So it causes pure red cell aplasia. Come inside. I'll call them. No problem. AC may be little extra cold. Many places people are complaining no AC. AC is not working. Your complaint is little ulta. Okay. Okay. So no, many places or say no AC so hot like that. But here little opposite. Okay. I'll call the people. AC band. My Hindi sufficient. Listen. Next is, see, it is very, very important. You must know hepatitis B markers. Hepatitis B markers. Listen to me carefully. Listen to me carefully. Hepatitis B markers. Hepatitis B surface antigen positive. What does it means? Infection present. Core antibody IgM positive. What does it means? Acute hepatitis. Excellent. This is called acute hepatitis. Acute hepatitis. Surface antibody alone present. Yeah. There is no infection, no disease, only antibody. Excellent. It is called vaccination. Next is core antibody IgM alone present. Very early stage. Window period. It's called window period. Band. Okay. Window period. Okay. Window period. Next is core antibody IgG present. Post infection. Where, listen to me carefully, surface antibody present, core antibody present, only antibodies present. That means recently the person recovered from the infection. Recent recovery. Or convalescent phase. Convalescent phase or recent recovery. Convalescent phase, always called recent recovery phase. Recent recovery. Very important, my dears. Definitely you may get a question on hepatitis. So always remember, hepatitis one question will come, media one question will come, hypersensitivity one question will come. vectors, one question will come. Like that, you classify 5 to 7 topics, 7, 8 questions will be there, sure. Okay, next is a man admitted with dog bite. See, what category of bite this is? Category 3. Why it is category 3? Because multiple bites bite with bleeding. Bite with bleeding, multiple bites, or bite in the face, saliva into the wounds, or wild animal bite, or exposure in bats. Bats exposure. If all this comes under category 3 bite, so it's a category 3 bite. What is the name of the disease? Everybody says it is rabies, hydrophobia. Rabies, or is called hydrophobia. Rabies, hydrophobia. Agent, rhabdovirus or rabies virus. What is the management for category 3 bite? Number 1, immunoglobulin with vaccine. We can give both vaccine and immunoglobulin. Category 3 bite, you can go for vaccine with immunoglobulin. What is the first G protein vaccine in the world introduced in India? Last year, very recent, they may ask you. First G protein vaccine introduced in India is Trabis vaccine. We call this as Trabis vaccine. We call it as Trabis vaccine. Okay, vaccine and immunoglobulin. Yes, Hitesh, perfect. Okay, what is the dose? 0, 3, 7 days. 1, 2, 3, rabies free. 3 doses, 0, 3, 7 days, that's all. With this we complete our 40 questions. Okay, right. Next is 45. 45 I told I'm in my statement. Yeah, listen. Make it very easy. Virus morphology. What shape? Brick. What is the agent? Brick shape virus is pox virus. Brick shape virus is pox virus. Pox virus is brick shape. What is this image? Satellite. Satellite shaped bacteria. You can get it in. Okay. It is adenovirus. Spaceship or satellite adenovirus. Adenovirus. Next is painless terminal hematuria. What is the disease called? Yeah, schistosomiasis. It is Schistosoma hematobium. Schistosoma hematobium. Structure name, what is the name of the structure? It is seen in men. Male worm. Gynecophoric canal. And listen to me carefully. What is the infective stage? Bifurcated tail. What is it called? Cercariae. Infective stage. The cercariae penetrate the skin. It causes what itch? Swimmer's itch. Cercarial dermatitis. What is the diagnostic stage? Egg. Egg with terminal spine. Egg with terminal spine. Can you tell what is the mode of transmission? The cercariae penetrate the skin. Okay, the cercariae penetrate the skin. Skin penetration. Cercariae penetrate the skin. Case of painless terminal hematuria, cercariae penetrate the skin. At the time of penetration of skin, it causes a itch called swimmer's itch or cercarial dermatitis. This is called schistosoma. This is called schistosoma. Where you can get lateral spine? Schistosoma manzoni. You can get knob-like structure. Schistosoma japonicum. Schistosoma japonicum. Schistosoma japonicum. Okay. Next is a case of pneumonia. See, interesting. Pneumonia as well as diarrhea. They give the life cycle. They give the life cycle. Man excrete the egg. Other person take the egg. It go to the lungs. Then coming to the intestine. What is that agent called? Ascaris lumbricoides. Because you have what serrated edges egg. Ascaris lumbricoides. Ascaris lumbricoides. What are the diagnostic stage? You can see the egg. Both fertilized and unfertilized. Infective stage, fertilized egg. Infective stage is fertilized egg. What is the mode of transmission? Ingestion, eating. Ingestion, not fecal-oral. Directly from stool, fecal-oral. Man excretes unfertilized egg. It becomes fertilized. Take some time. So fecal-oral route is not correct. Ingestion. And what is the disease it causes? Ascariasis. Loeffler's pneumonia. Loeffler's pneumonia. Ascariasis. Intestinal obstruction. Ascariasis. Intestinal obstruction. Intestinal obstruction. Next is a case of cystic lesion in liver. What cyst? Hydatid cyst. Because dog excrete the egg, man take the egg, life cycle continues. So agent is Echinococcus granulosus. Agent is Echinococcus granulosus. Diagnostic stage is larva. You can get brood capsule. Scoliosis. Brood capsule and scoliosis. dog tapeworm. Infective stage, what man eats? Egg. Hexacanth egg. Mode of transmission, eating, ingestion. It causes a disease called hydatid disease. It causes a disease called hydatid disease. Come on. What is the name of the skin test? Cazzoni test. We are using a skin test called Cazzoni test. Okay, Cazzoni test we are using. Brood capsule scoliosis. Scoliosis. Brood capsule or scoliosis? Larva. Next is stool microscopy. Very simple. Can you tell what type of egg it is? That's all. After seeing the egg itself, you should tell it is operculated egg. Operculated egg seen in Diphylobothrium latum. Diphylobothrium latum. All trematodes except Schistosoma. Facialopsis busky. Facial hepatica. Clonachis sinensis. Clonachis sinensis. And Paragonimus westermanni. And Paragonimus westermanni. These are all the people has what type of egg? All these people are having operculated egg. Okay. We completed 45 questions. Now the time is 11:54. I'll give the break. Sharp 12:15 assemble here. 12:15 we'll resume the session. Thank you. 12:15 we will resume the session. Okay. Yeah, assemble fast. Assemble fast. We already completed 45. So now we have total 82 questions, 82 slides. 37 slides there. Apart from that, we have 45 questions are there. MCQs. Before 2 o'clock we'll finish, or 2 to 5 like that. Nothing wrong on it. Yeah. So I'm starting the session. Welcome back. Yeah, welcome back. We are restarting the session. Just to see there, the recording is pause or this recording is going bottom. Yes, not pause. Cool. Right. Next is listen. It is very important to learn intermediate host in human parasites. Can you tell what is the intermediate host here? Can you tell what is it? If you don't know, it's like a cockroach. I will tell. If you don't know the vectors, all vectors are look some different cockroach. Okay, this is called cyclops. Otherwise called water flea. It is an intermediate host in two conditions, two diseases. One is Diphylobothrium latum. Diphyllobothrium latum. Another one is that disease not there. Almost it's eliminated from India. What is it? Dracunculus medinensis, guinea worm disease. Dracunculus medinensis. It is otherwise called guinea worm disease. What is it? Everybody knows. Yeah, snail. This is snail. Snail is a vector for? Snail is vector for, it's a intermediate host, not vector, slip of the tongue. It's a intermediate host for all trematodes, which includes Schistosoma, all this thing. Schistosoma, Fasciolopsis buski, Fasciola hepatica, Clonarchis sinensis. What else? And Paragonimus westermanni. And Paragonimus westermanni. Okay. Got it? That's all. So you must know the intermediate host of human parasites. Next is very, very interesting. Unless otherwise, all trematodes, snail is the intermediate host. What are the trematode? Schistosoma, Fasciolopsis buski, Fasciola hepatica, Clonarchis sinensis, and Paragonimus westermanni. And Paragonimus westermanni. And Paragonimus westermanni. Paragonimus westermanni. Yes, it's called fish tapeworm. Diphyllobothrium, otherwise called fish tapeworm. I got a comment in the chat box. I am seeing eMedicos app also. Some of my other kids from Jaipur and many places, they are using what eMedicos. They're learning from eMedicos. I got a beautiful comment. They're beautifully answering also. Microbiology can only be remembered with the help of this workbook, sir. Finally they got the because picture and story easy. Seeing the picture, read the story. Seeing the picture, read the story. But if you already studied microbiology, it's really a feast to you. You can enjoy many things. Come on, next is intermediate host in human parasite. This is called aquatic plant. Aquatic plant. Aquatic plant, listen to me carefully. Aquatic plant, come on, what is the intermediate host? Aquatic plants. Fasciolopsis buski and Fasciola hepatica. You remember? Fasciolopsis buski and Fasciola hepatica. And what is it? Everybody knows. Yes, crab. Crab is the intermediate host for Paragonimus westermanni. Paragonimus westermanni. Paragonimus westermanni. Crab is for Paragonimus westermanni. Excellent. Next is fish is the intermediate host for. This is called fish. Everybody knows. Fish is the intermediate host for fish tapeworm. What is the fish tapeworm called? Diphthobothrium latum. Apart from that, fish is the intermediate host in Clonochis sinensis. Clonochis sinensis. This is print version. If you see a PowerPoint version, you can see little animations. You can enjoy little animations. I will show that also. See here. Sorry, it's also not coming. Okay, no problem. Right, listen to me carefully. What is it? What is the intermediate host? Cattle. Cow also acceptable. Cattle. Cattle is the intermediate host for which condition? Taenia saginata. Because Taenia saginata otherwise called beef tapeworm. Taenia saginata, it's otherwise called beef tapeworm. Taenia saginata, we call it as beef tapeworm. We call it as beef tapeworm. Taenia saginata, beef tapeworm. Okay, we should know the intermediate host. Make a list of intermediate host. We have seen intermediate host fish, cattle, plant, apart from that crab, okay, snail, cyclops, everything. What next? Human. Where human act as a intermediate host. Human act as a intermediate host, classical intermediate host in Plasmodium. Plasmodium, what is the definitive host? Female Anopheles mosquito and Babesia. These two conditions, man is the classical intermediate host. Some condition, man is the dead end intermediate host. Dead end intermediate host. Toxoplasma, Echinococcus, and one more, Trichinella spiralis. All these conditions, human act as a intermediate host. All these conditions, human act as a intermediate host. Got it? Human act as a intermediate host. So, nothing but you should know all intermediate hosts. So, what are all the intermediate hosts available? Fish, cattle, human, cyclops, crab, plant. What are maximum? Maximum. Still something is pending. It's coming on the way. On the way. What is the egg? Excellent. How to describe? Barrel shaped egg with mucus plaques. Barrel shaped egg with mucus plaques. What is the agent? Trichuris? Trichura. Trichuris? Trichura. Trichuris? Trichura. What is the common name for Trichuris trichura? Common name for Trichuris trichura? Whipworm. Common name is whipworm. What disease it causes? Any idea? Excellent. In case of children, it produces rectal prolapse. We call it as coconut cake rectum. We call it as coconut cake rectum. In children, it produces coconut cake rectum. In case of adults, it causes iron deficiency anemia. In case of adults, it produces iron deficiency anemia. Iron deficiency anemia. After seeing the egg, you need to identify it's a treacherous trichura because of barrel shape with mucus plugs. After that, these 5 points sufficient. With this, we complete 50 slides. 50 slides. Still long way to go. Long way to go. You must know all eggs. See? What about the image? What about the egg? It is plano-convex, kidney-shaped egg. It is plano-convex, kidney-shaped egg. What is the agent called? Enterobius vermicularis. Enterobius vermicularis. Common name? Pinworm. Any other common name? Very good. Seatworm. Common name pinworm. It's a very common name. Sometimes we learn seatworm. What is it causes? Excellent. Apart from that, child scratch the ass. Keep the finger in the mouth. Auto infection. Yes, auto infection. Remember, A. Anal pruritus. Anal pruritus. Auto infection. And appendicitis. Yes, Kamal. Kamal is firing. Okay. Appendicitis. Okay. Appendicitis. Anal pruritus, appendicitis, auto infection. So what is the mnemonic? Right. Should not forget. And I can add one more A also. Treatment, albendazole, mebendazole. One more A. Okay. Next is child with lesion in the image. See, beautiful. Snake like it going under the skin. Wow. This is called cutaneous larva migrans. CLM, cutaneous larva migrans. So diagnosis, cutaneous larva migrans. We call it as CLM, cutaneous larva migrans. What is the agent causing? Hookworm, ankylostoma. Oh, I told the next answer, sorry. Okay, ankylostoma. Or necator. Ankylostoma duodenale, ankylostoma brasilensis, mainly brasilensis, necator americanus, those kind of people. What is the common name? I already leaked hookworm. What is it causes hookworm? Number one, it causes cutaneous larva migrans. It's in the list. But when the hookworm enter into the skin, it causes a itch called ground itch. Ground itch, very important. It causes ground itch. And in the intestine, it causes iron deficiency, anemia. In the intestine, it causes iron deficiency, anemia. Iron deficiency, anemia. Okay, next is adult. See here, that is children. Listen to me, this child, see the lesion. Next question, same thing, adult with same kind of lesions. See the lesion, lesion is little wide, and here the urticaria is present. This is called larva currents. No confusion with cutaneous larva migrans and larva currents. Larva currents. Which agent causes larva currents? Strongyloides stercoralis. Larva currents caused by Strongyloides stercoralis. Larva currents, Strongyloides stercoralis. What is the infective stage of Strongyloides stercoralis? Filariform larva. Mode of transmission, skin penetration. Because of that skin penetration, it go under the skin like a snake. Larva currents. So infective stage, filariform larva. Infective stage, filariform larva. Mode of transmission, skin penetration. What is it causes? Hyperinfection syndrome and also autoinfection. It causes autoinfection and hyperinfection syndrome. Autoinfection, hyperinfection syndrome. Adult lesion with this image. So no confusion with cutaneous larva migrans and larva currents. Cutaneous larva migrans seen in children caused by hookworm. This is seen in adult. Larva currents caused by Strongyloides stercoralis. Cutaneous larva migrans, no urticaria. Here urticaria present. These are the major differences. Next is child with this image. What is it called? Unilateral periorbital edema with ptosis. Yes, this is called Romanov sign. The disease is called Chagas disease. Chagas disease. Chagas disease. Chagas disease. Agent? Which agent causing Chagas disease? Trypanosoma cruzi or bruzi? Cruzi. Trypanosoma cruzi. What is the vector? Very important. What is the name of the bug? Rhodioid bug, kissing bug, triatom bug. Okay. Everybody remember kissing bug, huh? Yes. Triatom bug, rhodioid bug. What is the very common name? kissing bug. There are other names are there like cone nose bug, assassin bug. No need to remember. Remember these three sufficient. Remember these three sufficient. What is the name of the sign? Just now you people told. Romanov's sign. Romanov sign. How it got transmitted? Stercorian via stool. Mode of transmission via stool. Stercorian transmission. Mode of transmission, Stercorian transmission. Yes, this is about Chagas disease. This is about Chagas disease. Next is patient with dysentery. Stool microscopy. It contains lot of cilia and the horseshoe shaped nucleus, macro and micronucleus. What is it? Balantidium coli. This is called Balantidium coli. Balantidium coli. Agent. Image description is ciliated trophozoite. Ciliated trophozoite. Agent Balantidium coli. Come on, what is the natural reservoir? Balantidium coli, natural reservoir is pig. And accidental reservoir is human. Can you name what type of motility? Yes, very good. Football motility or reversion motility. Football motility or reversion motility. Football motility or reversion motility. I got a beautiful question. Very practical question. Sir, if someone has not studied microbiology till now, is this book is sufficient? I don't want to give you false promise. Okay? This book is okay. Something is better than nothing. This book gives 500 points. Definitely if 15 question comes, you can answer 8 to 9 questions from the book. Enough. That's I will say. Then what is the difference between the people who studied whole book? Okay, some questions may be tough, but average. If you want a topper, read the book. If you want to pass, read the notes. It's up to you. Okay, do you decide? I want to give interview. If you want to give interview, okay, read the book. If you want to listen the interview, right, that's all. Whether the performer or spectator, you decide yourself. Okay, that's all. Yes, yes, it will be helpful to you. It's a last minute weapon. I typed. It's a last minute weapon. No other go. I didn't study microbiology. Last minute. Then we give something. This is the last minute. You do something. Patient is in ICU. Anyway, he is going to die. We give some treatment. They will, okay, right. Hey, just for fun. This is very worth, because 500 points in one notebook. Definitely, if you read the 500 points, you may get 5 to 7 questions, direct questions. Sometimes indirectly help you to answer many other questions. Okay, don't be panic. This much assurance I can give. PLHIV with persistent diarrhea. HIV diarrhea, what is the common cause? HIV positives diarrhea, coccidian parasites. We call them as coccidian parasites. Very small, 4 to 6 micrometer, 4 to 6 micrometer is cryptosporidium. 8 to 10 micrometer ghost cyst. Very good. Partial cyclospora. Always oval shape. Isospora. Now the new name is cystisospora. Excellent. Cystisospora. If you read microbiology, you can enjoy all those things. What is the stain? Acid fast stain. Modified acid fast stain. Modified acid fast stain. Modified acid fast stain. Complication? Cholecystitis. 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 And our experience we are telling, we did the same thing for NEET DBT, but here very easy for you, handy. They are giving individual books, individual subject. NEET book is this much big, 1000 pages, one book. Many of the kids last minute they revised the same thing, they got excellent rank, and everybody in the interview they simply told, we attended DBT, we studied DBT, we did only PYQ, we got this rank, we got this rank. It became a trend. After that many kids, they don't want to read, they buy only post class, post exam, the sales was going like anything. At the time of DBT, sales is normal. Post DBT, we got lot of demand because yes, questions came from there, especially before the NEET and UNICET, many people purchased, and that is the truth. When we say you read this sufficient, many people didn't believe. How? Only one book is sufficient, like that, only few people. Once they got the rank, then because nothing, it's a juice, that's all, concentrated juice. Next is ova found in stool microscopy. See the ova, how they look like. This is called hexacanth egg. Hexacanth egg. We call it as hexacanth egg. Next is, what is the diagnostic stage? Hexacanth egg is diagnostic stage for Taenia saginata, Taenia solium, Hymenalepsis nana. All these three people man excretes. You do the stool examination, you can find Taenia saginata, Taenia solium, and Hymenalepsis nana. These three people, it is the diagnostic stage. Infective stage, after eating egg, disease develops. Number 1, Echinococcus granulosus from the dog. Echinococcus granulosus. Number 2, Hymenalepsis nana, because there is no intermediate host. Rarely, Taenia solium, eating egg, neurocystic sarcosis. Taenia solium, eating egg, neurocystic sarcosis. Eating egg, neurocystic sarcosis. Okay. Give me a minute. Just a minute. Yeah, energy like Chota Bhim. Right. Listen to me. This is ova found in stool microscopy. Next is patient with fever chills and dark urine. What is the diagnosis? Patient with fever, chills, dark urine, hemoglobinuria, black water fever. What is it called? Plasmodium falciparum. Sir, I don't know, sir. No problem. See the picture. What is the description called? Banana and boat-shaped gametocyte. Game over. What is the diagnostic stage? Diagnostic stage is gametocyte. Especially what type of gametocyte? Banana or boat shape, and ring shaped trophozoite. Multiple ring, we call it as Acol formation. Multiple rings, we call it as Acol formation. What is the agent? Plasmodium falciparum. Plasmodium falciparum. What stain? Jimsa stain, old stain, Jaswant Singh Bhattacharya. Don't remember, remember Jimsa stain. It's a $1 million question. What is the vector for malaria? Don't say Anopheles mosquito. Say female Anopheles mosquito. That is important. Males are very, very sadhu. Okay? Soft. Female Anopheles. Females are very arrogant in Anopheles mosquito. Female Anopheles mosquito. Just for fun, don't take anything serious. Understanding purpose. Yeah. I can't tell this in my house. I'm not having that much guts. So here I can tell. Okay. Female Anopheles mosquito. What is the infective stage? When the mosquito bites, what enters in the body? Sporozoite. Sporozoite. When the mosquito bites, the sporozoite enter into the body. The sporozoite enter into the body. This is about Plasmodium. You must know Plasmodium. What is the infective stage? What is the diagnostic stage? What is the disease caused by? Everything you should know, because a very important topic. Malaria. Next is protozoa infects all nucleated cells. What is the protozoa? That is a clue. One protozoa infect all nucleated cell. All stages are infective. Is Toxoplasma. It's a case of Toxoplasma. See the infective stage. From the cattle, man eats the meat. The meat contains bradycyst. Okay, and cat excrete feces containing oocyst. Once it enters into human being, man to man transmission via blood transfusion or mother to child. Infective stage is tachyzoid. So this is from meat eating, this is from cat feces, and this is from circulation. Circulation. Mode of transmission, ingestion. This also ingestion. Where circulation either by placental transfer or mother to child transfer. That is or blood transfusion. Blood transfusion. Blood transfusion. Okay. Next is next one. I didn't see. I'm going to see now. Yes, you are perfect. Why you are not saying it is Giardia? Because two reasons. One reason, if you are a legend, you can answer, okay, it is having one nucleus. There are two nucleus in Giardia. Giardia. If ultra legend, you can answer vaginal discharge. Giardia causes diarrhea. It never involved in vaginal discharge. One and only protozoa vaginal discharge is Trichomonas vaginalis. Trichomonas vaginalis. What is the motility? What motility it exhibits? Jerky motility or wobbling motility or twitching motility. Jerky motility or wobbling motility or twitching motility. Twitching motility. Jerky, wobbling or twitching motility. I have posted in the group this motility. You can just go through this. What medium? Culture medium. Only few mediums are there for protozoa. CPLM medium. Cystine, peptone, liver, maltose medium. CPLM medium. Another one is plastic envelope medium. Plastic envelope medium. What about the cervix? Somebody morning told. What about the tongue? Strawberry tongue. Cervix is strawberry cervix. Strawberry cervix. What is the infective stage? Hey, don't worry. This pathogen is having only one stage. Infective stage, diagnostic stage, all stages only one. Because it's having one stage. What is the stage? Trophozoite. Trophozoite. Trophozoite is the infective stage. Excellent. Kamal Kaushik is firing. And Deep Raj, Gitika Paul, great. I'm just observing people. Okay. Next is, we completed 60 questions. Total 82. Yeah. After seeing the picture, what comes to your mind? Excellent. People answered. This is called Maltese cross appearance. If you know it is Maltese cross appearance, inside the RBC, which agent causes Maltese cross? Babesia. Babesia microti. What is the vector for Babesia? Tick. Babesia look like malaria. Tick. Babesia look like, vector is tick. What anemia it causes? AIHA. Autoimmune hemolytic anemia. It causes autoimmune hemolytic anemia. Fantastic. What is the infective stage? Is sporozoite. Infective stage is sporozoite. Infective stage is sporozoite. Because malaria, plasmodium, babesia, all infective stages same. But vector is different. Vector is different. Next is blood stained sputum, ball like mass in chest X-ray, culture microscopy image, culture image. What is it? Ball-like image, aspergilloma. Everybody knows what is it. Because what color? Black. Aspergillus niger. Excellent. Yellow. Aspergillus flavus. Flav means yellow color. Flav means yellow color. What is green? Aspergillus fumigatus. Aspergillus fumigatus, yellow, green color. Tan green. Green fumigatus, flavus yellow, black niger. And assay for invasiveness. Invasive aspergillosis, there is a famous test called Galactomannan assay. If it is positive, it indicates invasive aspergillosis. Galactomannan assay. Galactomannan assay indicates invasive aspergillosis. Indicates invasive aspergillosis. Okay. Next is, what is PLHIV? People living with HIV and AIDS with altered sensorium, neck rigidity. What is the clinical condition? Meningitis. HIV positive patient with meningitis. What is the stain called? India ink or nigrosin stain. India ink or nigrosin stain. What agent? What agent? Budding yeast cell in CSF. Cryptococcus neoformans. Cryptococcus neoformans. What is the selective medium for Cryptococcus neoformans? There is a medium called bird seed agar or Niger seed agar. It produces what colony? Brown color or black color colonies. The medium is bird seed agar or Niger seed agar. It produces black or brown colony. It produces black color or brown color colonies. Why? Melanin. Important virulent factor is polysaccharide capsule and melanin. Do not forget melanin. Polysaccharide capsule and melanin. And melanin. Yeah. This with patient with altered sensorium. Neck rigidity. Got it? Next is, what is DKA? Diabetic ketoacidosis. Patient with frontal lobe abscess. Anybody uncontrolled diabetes? Yeah. Image description, what you can see? Aseptate hyphae with what? It is having root, rhizoid, nodal rhizoid, with aseptate hyphae. Aseptate hyphae. What stain? What is the color? Blue. What stain? Lactophenol cotton blue, LPCB. Lactophenol cotton blue, LPCB, lactophenol cotton blue. What is the agent? Internodal rhizoid, rhizopus. Rhizopus, nodal rhizoid, rhizopus. What disease it causes? Mucormycosis. Fantastic. Predisposing factor, remember my mnemonic, D, D, D. Diabetic ketoacidosis, dialysis, and desferrexamine therapy. Desferrexamine therapy, iron chelating therapy. Desferrexamine therapy or iron chelating therapy. Okay, desferrexamine therapy or iron chelating therapy. Yeah. Okay. Next is PLHIV with low CD4 count and pneumonia with pulmonary infiltrates. HIV positive and pneumonia, most common cause of fungal pneumonia and HIV positive. Pneumocystis. What is the name of the stain? Black color. Fungal stain. GMS stain. Gomari methenamine silver nitrate. Gomari methenamine silver nitrate. What appearance? Famous description. Broken ping ball appearance. Can you name the agent? Pneumocystis zerowasi. Pneumocystis zerowasi. What is the specimen? Ideal specimen for pneumocystis is BAL, broncho alveolar lavage. And what is the drug of choice? No antifungal, antibacterial. Cotrimoxazole, excellent. Cotrimoxazole. Cotrimoxazole is the treatment. So it's a case of Pneumocystis zerowasi. Next is women develops nodular skin lesion on the arm after pruning rose bushes. What is it? Structure. Asteroid bodies. That's all. Asteroid bodies. Which agent? Sporothrix. Sporothrix Schenke. Sporothrix. What is the name of the disease? Sporotrichosis. Common name Rose Gardner disease. It is dimorphic. In yeast it looks like, in yeast it is cigar shape, mold flower shape, floret shape. What is the drug of choice? Itraconazole. Drug of choice is itraconazole. Drug of choice is itraconazole. Okay, itraconazole. Next is, yeah, just all, everybody answering. Cauliflower like subcutaneous fungal infection. Image description, copper penny bodies. Other name, sclerotic bodies, medullary bodies, muriform bodies. It's diagnostic of chromoblastomycosis caused by cladospora, Fiolophora, Francesia, many people. The name disease is chromoblastomycosis. Chromoblastomycosis. Disease is chromoblastomycosis. Copper penny, asteroid bodies, sporothrix. Copper penny bodies, chromoblastomycosis, produces typical cauliflower-like lesions, wart-like, cauliflower-like lesions. Okay, next is PLHAV, white patches on the tongue. White patches on the tongue. What is it? Oral thrush, Candida. What is the name of the test? Germ tube test. It is positive in Candida albicans, especially HIV Candida albicans. And one more Candida dublonensis. But HIV most common is Candida albicans. What about the hyphae? It produces pseudo-hyphae. Sir, what is the difference between original hyphae and pseudo-hyphae? This is real hyphae. These are all real hyphae. This is pseudo-hyphae. What difference you are seeing? Constrictions. You are able to see constrictions in pseudo-hyphae. That is absent in hyphae. Hyphae uniform. Pseudo-hyphae, some constrictions will be there. In between, you are seeing the constrictions between the cells is pseudo-hyphae. Pseudo-hyphae seen only in Candida. One and only example in medical microbiology is Candida. Itchy, scaling, raised borders, skin lesion. Yes, what about the structure? Spindle-shaped macroconidia. Listen to me. Spindle-shaped macroconidia. Agent microsporum. Microsporum affects skin is default, all will affect hair, skin and hair. Epidermophyton, skin and nail. Trichophyton, all three. That's all. Just easy to remember. Easy to remember. Hypopigmented lesions in the skin. Image description, what is it? Banana, grapes or spaghetti meatball. Spaghetti meatball appearance or banana grapes appearance. Banana grapes appearance. What agent it causes? Malassezia furfur or Malassezia globosa. Malassezia. Globosa. What disease it causes? Tinea, yes, Tinea versicolor. And it is called lipophilic fungi. Why? It loves what oil? olive oil. It grows in the presence of olive oil in the culture medium. So we call it as what fungi? Lipophilic fungi. Lipophilic fungi. We have completed 70. Agent Malassezia furfur, Malassezia globosa. Two people. Malassezia furfur, Malassezia globosa. Okay. Next is very important. Final lap. Interesting, my dears. NRI, it is not reported from India, from Arizona, pneumonia and red nodular painful skin lesion. What is this image? What conidia? Chain-like conidia, arthroconidia. Okay, arthroconidia. Arthroconidia. Agent Coccidiasis immitis. Yeast look like spirule with endospore. You are aware of that. Mold causes, mold look like arthroconidia. What disease it causes? Desert rheumatism. San Joaquin Valley fever. Yes. San Joaquin Valley fever. Desert rheumatism. Desert rheumatism, San Joaquin Valley fever. Okay. San Joaquin Valley fever. Got it? Next is, yes, now the game starts. Cover to cover coverage. Nowadays, till now we have seen systemic bacteriology, mycology, virology, 111. Now all mixer. Okay. Tetanospasmin, what is the mechanism of action? Inhibit the release of GABA and glycine. Botulinum toxin inhibit the release of, very good, acetylcholine. You already answered. Diphtheria, what is the mechanism of action? Acting on elongation factor 2, inhibit what synthesis? Protein synthesis. Inhibit what synthesis? Protein synthesis. E. coli, stable toxin, increase cyclic GMP. Labile toxin, increase cyclic AMP. Shiga toxin, acting on 28S or 60S ribosome, inhibit protein synthesis. That means this slide will give you an idea of different mechanism of action. Different mechanism of action. You people get only hard copy or soft copy? Both. Soft copy in app. I got a message, we didn't get anything. Send me by soft copy available in eMedicos. Right. I typed soft copy in app, use it. No, some people may not be part of eMedicos. They'll send some lateral way. You write all your handwritten notes, sir, please. Moderate maybe, no problem. Next is listen. Yeah. Key clues for diagnosis. Vaginal tamponade. What disease? Toxic shock syndrome. Agent? Staph aureus. Toxic shock syndrome. Agent? Staph aureus. Okay, toxic shock syndrome. Next is antibiotic. Pseudomonas colitis called healthcare associated diarrhea. Healthcare associated diarrhea. Clostriditis difficile. Prosthetic valve. Infective endocarditis. Prosthetic valve infective endocarditis. Less than 12 months. Staph epidermidis. More than 12 months. Staph viridans. Less than 12 months. Epidermidis. More than 12 months. Okay, right. Got it? Everybody get hard copy, no problem. Maybe travel some. You people are Delhi, so printing plus is here. Directly from printing place you can get. If you go to Jaipur, other place, it take 1 or 2 days time actually. Okay, we need to. Next is listen. Anderson-Peterson body, molluscum. You need to revise, fast revision. Negri bodies, rabies. Laddu question, huh? Lipschultz bodies, herpes. Taurus bodies, yellow fever. You must remember all those things. Bollinger bodies, smallpox. Where Gornary bodies is vaccinia virus. Vaccinia virus. You people will get hard copy like this. I am telling online people. Camera. Okay. So don't worry. Don't be panic. Next is. Yes. Agent, medium and colony. Legionella. What is selective medium? Buffered charcoal yeast extract agar cut glass colonies. Where actinomyces grows in blood agar. Blood agar. We have what kind of colonies? Molar tooth colonies. Molar tooth colonies. Streptococcus pneumoniae, chocolate agar. Carum coin or Draughtsman colonies. Carum coin or Draughtsman colonies. Vibrio cholera, TCBS agar. Oil drop colonies. Everything is important. And finally, What is it called? Mycobacterium tuberculosis, LJ medium. Cauliflower-like colonies, otherwise called rough, buff, tough colonies. Rough, buff, tough colonies. Rough, buff and tough colonies. Rough, buff, tough colonies. Next is, yes, infections associated with animals. Okay, what is this animal? Pig. Pig is agent for Taenia solium and Balantidium coli. Apart from that, pig is the mixed vessel for Japanese encephalitis virus. It's called amplifier host. Pig involved in swine flu, H1N1, sorry. It also causes pig bell in Clostridium. It also causes pig bell in Clostridium. This is called beaver. Beaver fever caused by Giardia lamblia or Giardia intestinalis. Giardia lamblia or Giardia intestinalis. Beaver fever. What is this animal? Dog. Rabies. Apart from that, dog tapeworm, Echinococcus granulosus. Rabies. Dog associated with mainly rabies. Echinococcus granulosus. Anything dog? Yes. There is a fungal infection called Microsporum canis. Can means dog, canis. Microsporum canis. Cat. Toxoplasma. Cat scratch disease, Bottonella Hensley. Cat bite abscess, Pasteurella multocida. Cat bite abscess. Cat bite abscess, Pasteurella multocida. Infection associated with animals. Very important. Okay. Next is, what is the animal called? Nine-banded armadillo. Mycobacterium leprae. This is rabbit. Rabbit fever caused by tularemia, Francisella tularensis. And this is rat. Important disease, plague, Yersinia pestis. I'll write the name of the agent, Yersinia pestis. Leptospira. Rat, Yersinia pestis, Leptospira, any there? Rat bite fever, where you can get? Spirillum minus, Streptobacillus moniliformis. Streptobacillus moniliformis. Spirillum minus. Rat bite fever, they cause rat bite fever. Plague, rat is the reservoir. Leptospira, rat is the reservoir. Then rat bite fever, all. This is about infections with some animals. Still, parrot fever, psittacosis, chlamydia psittaci. This is pigeon. Pigeon dropping associated with Cryptococcus neoformans. Yes. Bat. Huh? Nipah virus, fantastic. Apart from that, rabies and Histoplasma capsulatum, bad droppings, Histoplasma capsulatum. Histoplasma capsulatum, bad droppings, Histoplasma capsulatum. European blastomycosis, otherwise called Cryptococcus. South American blastomycosis, you are aware of that. Paracoccidioides brasilensis, Brazil, South America. Okay, Paracoccidioides brasilensis. North American blastomycosis is Blastomyces dermatitis. Blastomyces dermatitis, North American blastomycosis. Okay. Next is, yes, common name, black disease. No, black disease, Kala Azar, Kala. Black death, plague. White plague, tongue twisting, tuberculosis. Pink eye, many people cause adenovirus, chlamydia. Blue pus, which organism produces blue color pus? Pseudomonas. And interestingly, blue death, cholera, very good. Yellow fever virus. Yellow fever virus. Yellow fever virus. Okay, listen to me carefully. Clinical clues. It's a climax, last slide. Erythema marginatum, where you can see acute rheumatic fever caused by Streptococcus pyogenes. Erythema arthriticum, seen in Haverhill fever, Streptobacillus moniliformis. You need to remember. Erythema migrans, Lyme disease, Borrelia burgdorferi. Erythema infectiosum, parvovirus B19, fantastic. erythema multiforme, herpes and mycoplasma. Erythema necroticans, lepra reaction 3. Erythema nodosum, lepra reaction 2. Erythema nodosum, leprosum. You must know this. We must know this. Got it? Clinical clues and agents. Be happy. With this we completed our, Now we are going to see previous year questions. Okay? Ready? 1, 2, 3 minutes, don't run. Okay? Yes. See, going. PYQ. I think same questions are there. Yeah, then no problem. Which organism cannot be grown in an artificial culture medium? Mycobacterium leprae. Because the artificial culture medium we cannot grow cream. Okay, it is chlamydia, rickettsia, ehrlichia, anaplasma, not mycoplasma. Mycoplasma for people not taking gram stain. Here non-cultivable. It is Mycobacterium leprae. So be careful. Same mnemonic. And also you can remember viruses, pathogenic Treponema. Pathogenic Treponema. Okay. Next is, which of the following used in blood spillage? Any blood spillage you can use what? Sodium hypochlorite. Chlorine based. 1 to 5%, 0.5 to 5% available. So average you are using 1%. Blood spillage, always think of, Good session with no major technical issues. Thank you, sir. In technical issue will come? Sometimes no problem. You need to overcome. Wherever you keep on finding fault, till your last breath you find fault only. Not only in subject, not only teacher, life also. You find fault on your life partner, till end you find fault only. Whatever you get satisfied with it, enjoy. That's all. Because this moment is important. What your advice, huh? Right. Patient comes to the emergency with history of IV drug abuse and develop infection. Which are the following most likely cause? Please remember, wherever intravenous drug use, diabetes mellitus, you think of these three people. Number 1, Staph aureus in gram positive side. In gram negative side, Pseudomonas. And one more fellow, do not forget, Candida. Wherever drug user, think these three people. So he may be most commonly with what disease? Staph aureus. Staph aureus. Staph aureus. Okay. Next is, patient is presented with some unknown fungal infection, you don't know. On histopathological examination, presence of sclerotic bodies. having a muriform cell. Yeah. People shooting, sir, chromoblastomycosis. Because you know sclerotic body seen in? Now it become known fungal infection, yes or no? We can't say it's unknown fungal infection because you identified. What is it? Chromoblastomycosis. What agent causing? Okay. What agent it is causing? Cladospora, Phelophora, Fantasia, all. Next is, patient is resident of Bihar, came to the OPD with history of diabetes and complaining multiple sinus draining foot. What is it called? Majura foot. Hey, these are the questions they asked the previous year. If you are able to answer, that means coming year also you can answer. You are titrating. Okay. What is it? Sinus, tumor, granules. GST, diagnostic of mycetoma. GST, diagnostic of mycetoma. Okay, diagnostic of mycetoma. Which of the following tested before transfusion except? Yes, very good, hepatitis A. In India, you need to do hepatitis B, hepatitis C, HIV, VD oral test, and malaria parasite microfilariae. These 5 tests you must do before transfusion. Before transfusion. Feeling hungry? No. Yes or no? Class will be up to 2 o'clock. Even if you say yes also, class 2 o'clock. No also, class 2 o'clock. Don't worry. Don't think if we say no, I'm going to take 3 o'clock. Not like that. We are almost nearing the border. We'll reach, don't worry. Next is blood bag. Very important question. Blood bag disposed to yellow bag. Urine red. Urine bag, other collection bags red color. Infected plastic. It comes under yellow color. Because blood bag, 2 things. It contains blood. Second thing, it is made up of non-PVC material. Okay, very good, very good. A post-COVID patient presented to the OPD with progressing nasal discoloration, block, diagnosed as mucormycosis. Which of the following he can treatment? Amphotericin B. This is called mucormycosis, already diagnosed. Treatment for mucormycosis, amphotericin B. Best treatment, amphotericin B with surgery. Best treatment, amphotericin B with surgery. Liposomal preparation, yes, Kamal Kaushik. Which organism do not have cystic stage? Beautifully people answered. Trichomonas, because Trichomonas is having only 1 stage. Only trophozoite. All other people are having cyst and trophozoite. Hey, these are all the questions they asked. Now it is easy. Same question in the exam hall, you become tensed. You are seeing with the medicine, surgery, other all subjects, no. You become panic. Many times people beautifully answer here. If I ask the question, my classmate, he will answer beautifully. But in Viva, he can't open the mouth because of tension. That tension should not be there. That inhibition should not be there. Cat scratch disease. Yeah, this all you already studied in the workbook. Yes or no? If you know the workbook, you can answer. Botanola, Hensley. Toxoplasma, cat is the reservoir, source. Okay, right. A person went for trekking on a mountain, bee sting. Later person develops edema, redness. With the antibody responsible, this is called what type of hypersensitivity? Type 1. Which antibody involved? IgE. IgE. Type 1 IgE. That's all. Confidence. If you know the subject, your level of confidence is unmatchable. Next is RH incompatibility the mechanism that is involved causing reaction is immune complex is not RH incompatibility. RH incompatibility, hemolytic disease of newborn, comes under type 2 hypersensitivity, cytotoxic. Allergic is type 1, delayed type 4, immune complex type 3, this is type 2. HDN comes under type 2. Beautiful, beautiful. Earliest cell involved in inflammation among following is, who is the first fellow involved in inflammation? Neutrophil. These and all very, very simple questions. Sometimes you may get few simple questions also. A child has complaints of recurrent infections. Investigation showed thymic hypoplasia, hypocalcemia. Which are the following diseases associated with? What is it? Yeah, thymic hypoplasia, hypocalcemia. What is the syndrome called? DiGeorge. You know what is catch? 22. Hyper IgM is different. IgM alone will be high. Leukocyte addition deficiency, chronic granulomatous defect in what? Phagocytic defect. These people, phagocytic defect. Patient presented with discolored patches on the skin. Microscopic image shows spaghetti meatball. What else you want? Spaghetti meatball. Malassezia furfur. Spaghetti meatball already they gave. Even if you don't know the picture, they already gave spaghetti meatball. Go for Malassezia furfur. People taking only few seconds answering, not even take 1 minute. Patient comes to the hospital with complaints of fever and headache. On examination, black necrotic area was noted on the bridge of the nose along with swelling on side of the face. Mucormycosis. What is the risk factor? DDD, diabetic ketoacidosis. Dialysis, another one is dysparexamine therapy. Diabetic ketoacidosis common, very common. Patient has complaints of fever and rigorous chills. Microscopic examination image shown below. Identify the organism. Banana or boat shape. Over. Game over. What is it? Plasmodium falciparum. If you are able to see banana or boat shape gametocyte, close the file, it is falciparum. Or multiple rings in the cell. RBC, Acol formation. If you read the notes properly, you can answer all the questions. A child has fever. What is it? Yeah. Nobody reading the question. After seeing the slapped cheek, then directly going for erythema infectiosum. You must have at least courtesy to read, my dear. Okay. Runny nose, headache and rash shown in the image. Caused by single stranded DNA. Game over. What is it? Fifth disease. Erythema infectiosum. Single stranded DNA. Child was brought to the hospital with swelling around pinna, painful salivary glands, testicular swelling, orchitis, testicular swelling, orchitis and parotitis. You can directly go for what? Mumps. You people directly shooting. I'm so happy. I thought you people will struggle like that. No. Question is struggling. A patient admitted with complaints of severe headache, fever and knuckle rigidity. Lumbar puncture was performed that showed high protein, glucose, white cell count, 99% polymorphs. Microscopic organism is differential motility or tumbling motility. Which organism exhibits tumbling motility? That's all. If you know tumbling motility, Listeria, game over. Dotting motility? Vibrio. Dotting Vibrio on Campylobacter. Okay. Tumbling, Listeria. Corkscrew, Spirochete. Lashing, Borrelia. Just go through this. Go through the different type of motilities. A patient admitted due to complaints of fever, cough, shortness of breath, sphincter hemorrhage. Vegetations on the valve were noted. Organism found to be cocaine chains. Optochin and bile cells are resistant, no problem. Which of the following organism most likely? See, cocaine chains, it is not Staphylococcus, because Staphylococcus is what? Cocaine cluster. Okay, Streptococcus viridans, because it causes prosthetic valve infected endocarditis. Streptococcus viridans group. Example for Streptococcus viridans group is sanguis. It belongs to viridans. Sanguis, mutants, all comes under Streptococcus viridans group. Streptococcus viridans group. Next is Condyloma acuminata caused by HPV. Condyloma lata, syphilis. Secondary syphilis, Condyloma lata. Condyloma acuminata is human papilloma virus. This is Condyloma lata. Condyloma lata. Superb. Patient was treated with clindamycin. Shortly after antibiotic, they developed diarrhea. Antibiotic associated pseudomembranous enterocolitis. What organism? Clostridium difficile. Old name Clostridium difficile. That's all. After reading the question itself, you get the answer. Clindamycin, diarrhea. Mind immediately goes to Clostridium difficile. If it is that, right. You yourself know whether you are going to qualify or not in the exam itself. Only you know and your conscious know. After coming out, your parents ask, that means I did well. But your mind will tell you really did well or not. Yes or no? That's obvious. A child was brought to the hospital with complaints of fever, difficulty in swallowing, edema in the neck and greyish white membrane. What is it? Corynebacterium diphtheria. This is called pseudomembranous tonsillitis. Pseudomembranous tonsillitis. Okay. Granuloma inguinal caused by? No. Granuloma inguinal caused by Klebsiella granulomatis. It's a STI. LGV caused by Chlamydia trachomatis. LGV caused by Chlamydia trachomatis. Chlamydia trachomatis. Okay, right. Female present with vaginal discharge. Microscopic examination, clue cells. Yeah, bacterial vaginosis. Drug of choice for bacterial vaginosis or Trichomonas vaginosis, metronidazole. Drug of choice is metronidazole. Whether it is bacteria or protozoa. In case of fungal, you can go for fluconazole, amphotericin B, those kind of things. TB patient shows resistance to isoniazid rifampicin, kanamycin fluoroquinolones. It is called what? XDR TB. Only isoniazid rifampicin, MDR. Only isoniazid and rifampicin, we call it as MDR. This is XDR. This is called XDR. Yes, Kamal. Strawberry cervix is same. Trichomonas vaginalis, strawberry cervix. Next is child with history of sore throat later found cola color urine. What is the most likely diagnosis? Cola color urine. Post-streptococcal glomerulonephritis caused by Streptococcus pyogenes. What is the mnemonic? Sore throat, puff face, piscoke, Streptococcus. Piscoke, puff face, facial swelling because of glomerulonephritis and sore throat. Think of Streptococcus. Patient was diagnosed with TB. Which stain? Zidane stain. These are all LKG questions. People, because no, if you studied it is easy. If you didn't study, it's a tough question. The same question will be look tough if you're not prepared well. That's the problem. If you prepare well, it is very silly question to you. E. coli can be best grown among the following: deoxycholate citrate. This all for Salmonella and Shigella. Salmonella and Shigella. E. coli happily grows in mechanic agar. It produces what colony? Lactose fermenting colonies. Lactose fermenting colonies. Lactose fermenting colonies. Antibody dependent enhancement. The existing antibody enhance the infection in one condition. Which condition? Dengue. Dengue, if the person infected with another serotype, the existing antibody, pre-existing antibody increase the infection. Pre-existing antibody increase the infection. Cheap test for syphilis. Cheap in the sense paisa, not okay, is very simple RPR test. Because VDRL you need to do at least 300 tests. If you open the pack, you need to do 300 tests. TPP8, FTAP is a very costly test. So simple, easy, cheap test is RPR test. Rapid plasma reagent. Only dimorphic fungi which is also subcutaneous. See, this is the mnemonic for dimorphic fungi. Sporothrix, Talaromyces, and systemic mycosis. This is opportunistic mycosis. This is systemic. So one and only subcutaneous is Sporothrix. Sporothrix is a dimorphic fungi. You know that. Cigar shape yeast, flower shape mold. If you read my notes originally, it gives a lot of clues to you. It gives a lot of clues to you. Yes. People get bored. Sir, boring sir, this picture. What is it? Owli appearance. Owli appearance, which virus? That's all. Renal transplant, Owli, cytomegalovirus. That's all. Triad, remember. Adult male with multiple sex partner present with genital ulcer. What is the next? You can go for dark field microscope. What you can see? Syphilis. Treponema pallidum. You can demonstrate syphilis, Treponema pallidum. Genital ulcer, painless ulcer, that is important. A female presented with foul smelling vaginal discharge. Microscope revealed motile protozoa. Again boring. Protozoa vaginal discharge, one and only fellow. Who is that? Trichomoniosis. Curdy white vaginal. Rotten fish smell, bacterial. Rotten fish, bacterial. Curdy white candida, it's called moniliasis, where protozoa one and only is Trichomonas vaginalis. Okay, next is traumatic implantation of the forest worker followed by formation of cauliflower like lesion. Same picture you already seen. What is it? You become sensitized after seeing, hey, this is chromoblastomycosis. Go. Like every question you should go with this. Okay, chromoblastomycosis. No need to think much. You know what is the agent causing, what is the other name, that's all. This is key points you need to remember. Okay, next is cattle farmer lesion in the arm. Microscopic shows brick or box shaped gram positive organism. Boxcar appearance. Okay, what is it? It is Echar boxcar appearance, gram positive bacteria. Bacillus anthracis. If good in subject, nobody can shake you. Culture media used to differentiate lactose and non-lactose. Meccan ki agar. Chocolate agar is not a medium. Nutrient agar, it will not differentiate. Meccan ki agar, lactose fermenter, pink colonies, non-lactose fermenters, colorless colonies. Urease differentiate urease positive, urease negative organisms. Antibody present highest concentration in blood is G. What is the mnemonic? Gamma. Highest concentration G, lowest is E. Gamma. Image shown here used for diagnosis of all except. Okay. No, all image, this question is wrong. Image shown here is used to diagnose of herpes simplex virus. This is called multinucleated giant cells. Question is wrong. Please adjust. Multinucleated giant cells. Seen in herpes virus. Seen in herpes virus. What is the name of the smear? Zank smear. Name of the smear is called Zank smear. Macrophages in liver named as Kupper cells. Mesangial, kidney. Littoral, spleen. Where Langerhans, skin. You should know about, these are basics, fundamental. Which of the following is acid-fast organism? Cryptococcus, no, not Cryptococcus. These are all bacterial spores. Actinomyces, no. Nocardia, not Cryptococcus, Candida. These people are what? Acid fast. So acid fast organism is Mycobacterium avium. Mycobacterium avium is the typical acid fast organism. Don't confuse Candida acid fast, Nocardia acid fast, not Actinomyces. Bacterial spores are acid fast, not the fungal spores. Now the time is exactly 1:59. As per my promise, I close the session. Thank you very much. God bless you. Thank you very much. Okay, right. Thank you. Class dispersed.